Methamphetamine, or meth, is one of the many dangerous substances which can quickly lead to addiction. In this video, we will explain what meth is, how it is harmful, what its effects are, what the signs of abuse are, and how to receive treatment. Now, let's get started. What is meth? Meth is an addictive stimulant drug that works to increase levels of motivation and energy within the brain and body. These effects improve cognitive functions, decrease fatigue, and cause a euphoric happiness. Meth is classified as a Schedule II stimulant by the Drug Enforcement Administration. This means that it has very limited medical uses due to its potential for abuse and addiction. You may be wondering, how is meth harmful? Due to how potent of a drug meth is, meth use can quickly result in addiction and dependence. With the consistent use of meth, your body will become more and more accustomed to meth for proper function. The constant use of meth will also have harmful effects on your physical and mental health. This can result in heart disease, liver and kidney failure, respiratory issues, aggression, depression, and an inability to feel pleasure. These internal harmful effects also harm you externally in your relationships. An addiction will affect you as well as those around you. Addiction causes you to struggle with maintaining your responsibilities, both personal and work-related. Overall, meth's positive effects are temporary and will lead to many unwanted side effects and withdrawal symptoms after use. Moving into the side effects and withdrawal symptoms associated with meth abuse, there are some factors which will determine the intensity of these effects. These factors include how long meth was used, the amount of meth used, how frequently meth was used, and whether other drugs were used alongside meth. As meth will typically last between 8 to 24 hours, the side effects that come after that period can include chest pain, itchy skin, muscle tremors, hallucinations, weight loss, and fatigue. These side effects are uncomfortable and will appear in all uses of meth. Withdrawal symptoms are much more intense and can even be relapse-provoking. The meth withdrawal symptoms include depression, intense cravings, paranoia, anxiety, insomnia, and confusion. It is important for people who stop meth use to seek out help when stopping. Relapsing during the withdrawal phase can make you more susceptible to overdose. If you are concerned about a loved one, it is important to know the signs of meth abuse and addiction to look out for. These signs include dilated pupils, borrowing or stealing money, keeping a poor hygiene, sudden changes in mood or mood swings, changes in friends, neglecting personal responsibilities, decrease in appetite, extreme weight loss, having difficulties with personal relationships, and rashes or skin irritation. Although there can be other reasons for these signs to appear, a convergence of several at once can be a warning sign. It is crucial to get help as soon as you notice the signs of addiction developing in a loved one. Thankfully, there is treatment for meth. Similar to other substance abuse treatments, meth addiction will begin with a drug detox program that is followed up by various forms of therapy. Each treatment program will be individualized for a person to fit with their needs. Someone struggling with meth abuse will receive behavioral therapy to help rebuild and regain many of the functions that were lost to addiction. If you or a loved one are struggling with addiction, let Addiction Rehabs match you to a facility that meets your needs and start on your road to recovery with us today.